Dr. Shailja, how often do you see genetic etiologies in eye disorders in the clinic, and how do you manage them? So, genetic disorders are quite common as compared to our belief. Um I'm a pediatric ophthalmologist, and almost 50% of the pediatric disorders have some genetic basis. They could be directly single gene disorders like Mendelian disorders, or could be multifactorial disease where genetics plays an important role. So I would say that yes, every 1 in 3 child in my clinic would have some genetic basis. The key challenges in managing these patients are multifold. One is the main important thing is awareness about these diseases, because many of the regular ophthalmologists who would not be dealing with these patients quite often dismiss them as if nothing can be done for them. But lots and lots can be done for them. There is a notion that if it's a genetic disorder then it's untreatable. It is not true. Some of the diseases do have treatment available. You could also link them to ongoing clinical trials. Very important aspect is the family counseling, which probably you manage through genetic counseling, where the next generation, how will they suffer from the disease, what they can expect in this particular child in the future, whether any systemic involvement is there and we should be looking out for. Those things can also come up with genetic diagnosis. So when we refer to you, Ria, for a genetic counseling, what aspects of genetic counseling do you think is more important, and what key challenges do you face in getting a genetic testing done as also your counseling?
Yes. So when the patient is referred to us, oftentimes they do not even know what a genetic disorder is, especially in the absence of family history. So the first challenge is letting them know that these disorders can be associated with recurrence risk, for example, and that it has happened to one child or adult. It can happen to more children. For adults, we often also discuss how if they plan to get married soon, for young adults, that it can get into the next generation, and that's often a very hard pill to swallow for the patients. So genetic testing in that case often helps in terms for the patient to come to terms also with the genetic component of the disorder, to be able to offer prenatal testing to avoid recurrence risk and further family planning, and like you said, linking them to clinical trials also becomes important. Now the challenges we face, one of the top challenges I would say is one, realizing the importance of genetic testing, because it has been so long associated with no cure.
Yep.
That consent of patients is weak, and second is the affordability of genetic tests even today. So even though from 10 years ago the costs have come down significantly, it still remains high for a large part of the Indian population. So those two are the major obstacles we face.
Yeah, but I would say that given the cost is there, but the diagnosis is important. It's like I always give my patient an example that you are suffering with a fever and you don't know what kind of fever it is, how long it will last, whether it will affect your other organs of your body. So living without a proper diagnosis is like that. So genetic testing definitely helps. But sometimes, yes, you may not get a clear-cut diagnosis, and it's a complex thing. So how do you manage with the post-test counseling there?
So when there is no genetic diagnosis, for example, but clinically we are very sure that the etiology is going to be genetic, we often have to either advise further testing. For example, the most common test that is ordered in eye disorders is next generation sequencing panels. So whether it is an exome or it is an ophthalmology focused panel on eye genes, if that comes out negative, we have to go for further testing, because changes like large deletions and duplications can also exist in genetic disorders. So another investigation needs to be ordered. If all of that fails also in terms of we not getting any results, we don't stop there. We ask the patient to come back in a year or two to get it re-evaluated, because the discovery of new genes in causing genetic disorders is ongoing, and the literature and information we have keeps changing. And based on that, so many times we get patients with just the diagnosis of a retinal dystrophy. But how is it going to progress? What is going to be the course of the disease is some part of counseling that remains incomplete. So often genetic diagnosis really helps with that also.
Another aspect would be, for prenatal diagnosis, especially if you want to prevent the recurrence of very highly visually morbid diseases like, retinoblastoma or Leber's congenital amaurosis, where the choice is then with the parents to really go ahead with that pregnancy or not, because it's very difficult to live with or take care of children or patients with, uncurable diseases. So that's where again, a diagnosis and testing might help.